How can therapeutic fibbing help dementia patients? How can therapeutic fibbing help dementia patients? This approach, also known as therapeutic lying, is a communication technique used by caregivers to ease distress in individuals with dementia. It involves gently providing misleading statements to create a more comforting environment. This can be particularly helpful when patients struggle to understand reality due to cognitive impairments. Dementia affects short-term memory, logical reasoning, and perception. Patients may experience confusion, fear, or even hallucinations. When caregivers confront these altered realities with strict truths, it can lead to increased agitation. Instead, therapeutic fibbing allows caregivers to avoid these confrontations, promoting emotional regulation. For instance, if a patient is anxious about an upcoming doctor's visit, a caregiver might say they are going to a favorite place instead. This simple fib can significantly reduce stress. Caregivers also benefit from this technique. It can lower their stress levels by making interactions smoother and communication clearer. However, it is essential to use therapeutic fibbing thoughtfully. It should not be a blanket excuse for lying but rather a strategy aimed at enhancing the well-being of the person with dementia. The ethical considerations surrounding therapeutic fibbing are complex. While many see it as a compassionate approach, some worry about the implications of deception. Caregivers often face moral dilemmas, as lying is generally viewed as unethical. Yet, in dementia care, prioritizing the emotional safety of the patient can sometimes take precedence over strict honesty. Therapeutic fibbing is part of a broader range of non-pharmacological strategies for managing behavioral and psychological symptoms of dementia. These strategies aim to reduce agitation, anxiety, and confusion without resorting to physical or chemical restraints. By providing a gentler way to handle difficult situations, therapeutic fibbing can enhance the overall care experience. In practice, this technique should be applied selectively. Caregivers need to be sensitive to the individual needs and preferences of the person with dementia. Understanding the emotional needs behind a patient's words or actions is crucial. For example, if a person asks for a deceased loved one, a caregiver might say that the loved one is away but will return. This response can provide comfort without causing unnecessary distress. Overall, therapeutic fibbing can be a valuable tool in dementia care. It supports emotional regulation and improves the quality of life for both patients and caregivers. However, it should always be used ethically and as part of a comprehensive, person-centered care approach. Remember, this technique is not a substitute for professional medical care but rather a supportive communication strategy that can make a significant difference in the lives of those affected by dementia. Always consult healthcare professionals for personalized advice and care strategies.